Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a look at the state of obesity in the U.S. Nadine Gracia, President and CEO of Trust for America's Health, joined Stephanie Desmon to discuss her organization's recent report on obesity, which paints the landscape for a chronic disease that impacts the health of at least 1 in 4 Americans. They touch on ultra-processed food, GLP-1s, structural barriers to healthy eating, and cuts that threaten the progress that's been made. Let's listen.
Nadine Gracia, thanks so much for joining me.
Stephanie, it's a pleasure to be with you.
I wanted to talk about your organization's recent report on the state of obesity. And I'm wondering if you could just sort of start, where are we with obesity currently in this country?
Well, obesity continues to be really an important public health issue for the nation. If we look really over the past decades, in the last 2 decades, the rates of adult obesity have increased by 32%. The rates of obesity among children has increased by 52%. And we just see a population-wide increase in rates of obesity. In the report that we most recently released, it showed nationally that about 40% of adults have obesity, and that's slightly down from the previous year where it was about a little over 41%. And when you look across states, 19 states have adult obesity rates that are at or above 35%. And that's actually down from the previous year. That's a decrease from 23 states. That's actually the first time we've seen that kind of a decrease in states since this data set began. But the important thing to emphasize is the significance of obesity continue as an important issue of chronic disease, because still and yet every state has adult obesity rates at or above 25%. That means at least 1 in 4 adults. And so it continues to be an important public health issue that needs to be addressed in the nation.
Mm-hmm. And just for context, you did this 10 years ago. You found only 3 states had 35% or more obesity.
That's right. And when you see these kind of trends over a longer period of time and really seeing that across the population, you understand that there are broader factors. Obesity is a complex chronic disease. There are multiple factors that influence obesity that, go beyond individual behavior. It's structural and systemic issues around assuring access to healthy and affordable foods, having access to engage in physical activity, assuring that those healthy foods are available. These are the types of things and issues that need to be addressed when we also talk about chronic disease prevention.
And that's the key, of course, the reason that we're concerned about obesity is the chronic diseases that come with it.
Yes, that's right. Obesity in and of itself is a chronic disease, and it also increases the risk of other chronic diseases, diseases like type 2 diabetes, heart disease, certain types of cancer. And we can see that both among children and adults. And actually, children who have obesity are more likely to become adults who have obesity and also have additional health risks. But what we know is that there are programs, there are policies that are effective that can help us to prevent and reduce obesity.
You mentioned that last year's data kind of seemed a little bit leveling off. Could that be because of this trend of GLP-1s that are being used for weight loss?
That's an important question. And I think we need more data, more time to really assess that. And that's an important function of what public health does is to monitor that data over time to see what types of interventions are helping to address issues like obesity and other chronic diseases. I'll say that GLP-1s have been such an important opportunity in terms of the management and treatment of obesity. As we think about the treatment and management of obesity, we also have to address obesity prevention. It's not one or the other. And so really it's a spectrum in addressing obesity and other chronic diseases, and knowing that obesity prevention is critically important, just as is the treatment and management of obesity and other chronic diseases.
So what are your recommendations here for prevention?
we actually know what works in terms of proven prevention programs. A big challenge for us as a nation is that we have not invested in public health and chronic disease prevention programs to the scale that this nation needs with regards to adequately addressing chronic diseases. There are programs, for example, at the CDC where the funding that's available for proven prevention programs in obesity can only fund 17 states. If you look at this as a population-wide issue, we need to increase the investment in these types of programs. And what's concerning is that the recent and the proposed federal cuts to chronic disease, public health, and prevention really could put any kind of progress that we're making at risk. Because if we look at, for example, the CDC and its budget, the domestic budget of the CDC, more than 80% of that budget goes to states and localities, to tribes and other partners. And so when you make cuts to those public health programs, that actually is not just cuts that sit in Washington, D.C. or in Atlanta at the CDC. These are cuts to public health programs that are at work in states and local communities. We've seen, for example, the REACH program addresses providing programs that improve access to healthy foods, access to physical activity, improving breastfeeding, and also making those links from clinic to community. That program has had tremendous impact in terms of increasing the number of families and individuals who have access to these types of proven prevention programs. But these programs are at risk in terms of being cut. Looking at the state physical activity and nutrition program as another example. These are ways in which states and local communities have the types of proven prevention programs, but they need the resources to be able to provide those programs, especially in the communities that need them most.
We've been hearing a lot more about chronic diseases lately. The Trump administration and the talk of Make America Healthy Again initiative. There's been a lot of concerns about chronic disease and the role that nutrition plays. But at the same time, I do understand that the proposal is to eliminate most of the funding for the National Center for Chronic Diseases and Health Promotion at the CDC. So these feel like two different messages that are coming.
Yeah, it's really encouraging that there's focus on chronic disease prevention, whether it's through Make America Healthy. Again, it's these types of initiatives to focus on chronic disease because we know, as you mentioned, we're seeing rising rates of chronic disease in the country. So there's that health burden that so many Americans are experiencing. There's also the economic cost of this as well, where we know that chronic diseases and mental health conditions, for example, contribute to 90% of this health spending that the U.S. has every year, and that we have some of the highest rates when you look across other nations. But what is not matching with that is then our investment. As you pointed out, the president's budget does propose to actually eliminate the National Chronic Disease Prevention and Health Promotion Center. And not only is that about, when we talk about the importance of a center like that in terms of the funding that goes to states and local communities, it's also the expertise, the technical assistance that center provides to states and local communities each and every day on developing programs, implementing programs, and evaluating programs that will work for the communities that the states and local communities are serving. And so as we think about, these types of initiatives to focus on chronic disease prevention, it's important that there's adequate and sustained investment in public health and prevention so that we can address this important public health issue.
So the Trump administration has recently released new nutrition guidelines, and I'm curious your take on what you're seeing or if it's really just too soon to know.
The dietary guidelines for Americans, they are vital in terms of their importance with nutrition policy. They influence all of the federal nutrition assistance programs, but are vital to nutrition policy across the country. They inform, for example, school meals, the SNAP program, the WIC program for mothers and infants, and nearly 1 in 4 Americans and more than 20 million children are directly impacted. From the recently released guidelines, I'd say we're encouraged that the guidelines emphasize the importance of minimally processed whole foods, things like fruits and vegetables and whole grains, as part of a core healthy diet, as well as the focus on reducing the consumption of ultra-processed foods, which are associated with negative health effects. With regards to the dietary guidelines, is the process by which the guidelines were developed, and also the heavy emphasis in particular around the consumption of dairy and animal products, which, based on the research, does show higher health effects. And so I think it's important that we always want to assess that the research that is guiding these guidelines, especially because of the impacts it has in terms of policy and programs.
I feel, and please correct me if I'm wrong, it feels to me like obesity is an issue in the US far more than most other countries. And I'm wondering if we know the root of that.
Well, obesity actually, we see, is impacting countries around the world. And yes, rates differing across countries. But importantly, obesity is influenced by many factors that go beyond individual behavior. It's structural and systemic factors about assuring that people don't have barriers to having availability of affordable, nutritious, and healthy foods or engaging in physical activity. It's asking ourselves, are the communities designed in a way that actually promote health? And so factors like having access to affordable, healthy foods, poverty, to access to health care and housing instability, all of those types of factors actually influence rates of obesity. And so when we talk about the types of programs and policies to address rising rates of obesity, it also means addressing the community conditions. There are far too many families and people who live in communities where they may not even have access to a full service grocery store that has fruits and vegetables that are affordable. They may live in communities where it's not even safe to go outside and engage in physical activity, or they have low-paying jobs where being able to actually buy those types of healthy foods is just out of reach. We've also seen for our nation, like, the rising rates of food insecurity in households. The latest data actually show 18 million households had food insecurity, and that was actually a significant increase from the previous year. But yet, with the budget reconciliation that was passed last year, we saw some of the most significant, the largest cut to the Federal Nutrition Assistance Program, the SNAP program, at a time in which food insecurity is rising. We have to make those investments in the programs and policies that actually address those kinds of structural barriers, those types of systemic challenges that far too many families face, to being able to have access to and availability of healthy, affordable food and physical activity.
Well, this brings me to another part of your report that I wanted to ask about, which was the part about ultra processed foods. Can you tell me what you all recommend?
Yeah, so in the report, we did a special feature on ultra processed foods and really looking at the emerging science and policy considerations around ultra processed foods. Ultra processed foods have been gaining attention, national attention, a lot of policy attention over the years. And so what we wanted to present was really an understanding, what is the emerging science? And there's a growing body of evidence that is showing that ultra processed foods are associated with negative health effects and outcomes, including because of weight gain. You can have obesity and other conditions associated with the consumption of ultra-processed foods. What we also know is that 55% of the calories consumed by Americans, 55% of the U.S. diet comes from ultra-processed foods. So it's pretty prevalent in our food environment and food system. And so in looking at not only the science, what we present is really the policy considerations. There are efforts now underway in the federal government to develop a definition of ultra-processed foods, because what's also needed to be better understood is the umbrella term of ultra-processed foods, that some may have some health benefits versus others that don't. And also, that is helpful and important. But it's also important that we assure that as we encourage the movement away from ultra-processed foods, it's assuring that healthy, whole, minimally processed foods are available, that they're accessible, and that they're affordable. And so in the special feature, we talk about those issues in particular, that that there need to be more investment in policies to assure the availability of healthy and nutritious foods, that we can continue the efforts in terms of the food environment and food supply to make it healthier, so that the healthy choice is actually the easy choice, right? Reducing added sugars and sodium and saturated fat. It's also looking at the types of programs like the nutrition assistance programs, whether it's school lunches and school breakfasts, as well as other nutrition programs, continuing to improve the nutritional quality, and then also helping to inform consumers about the foods that they are purchasing, such as front of package labeling that helps to inform consumers about the nutritional content so that they can make informed decisions about their food purchases.
What is your one hope for the coming year? What do you see as the foremost issue?
Well, I think one, it's really continuing to raise awareness about the value of investing in public health and prevention. When we look at the rising rates of chronic diseases and other health conditions in the country and the rising healthcare costs, investing in public health and prevention is such a vital tool for us to be able to reverse those trends. By increasing and sustaining investment in public health and prevention, we can, one, help to reduce chronic diseases like obesity and other health conditions that are impacting the country. We can help to reduce healthcare spending that also is continuing on a rising rate. We can help to reduce health disparities that impact communities that are far too often under-resourced, whether that's rural communities or communities that are lower income, certain communities of color. It also will help strengthen our economy in terms of reducing our healthcare costs, but also having a healthier workforce, increasing the productivity and helping to support our economy. When you have a healthy population, you'll have a healthier economy. And that also will help even in our own national security. When we talk about the health security of the nation, a healthier population that is better prepared and more resilient with regards to health threats.
Nadine Gracia, thanks so much for joining me.
It was a pleasure, Stephanie. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.